Hello, I'm Shannon Brinker. I thank you so much for listening to my message tonight. For those of you that know me, I am a dental assistant, and I usually don't go on and give these messages, but maybe once every 2 or 3 years, it seems like. The last time was on a Sunday morning, bright and early rant. This one is not a rant. This one is one that I hope that most of you will listen to tonight. I am coming with you with very sincerity and most importantly, hoping that I open your eyes and your ears and your hearts to some of the things that are happening in dentistry right now. I, during COVID, went back to work in a practice. I was working part time in an office, but a very good friend of mine asked me would I come in and work in the practice as his dental assistant because he had lost one when COVID happened. And I, of course, loved and adored this doctor and went to work for him and just really felt, oh my gosh, I'm getting a chance to work with someone that I absolutely adore and love and very much respect. When I went into the office, I did not realize and didn't know exactly some of the things that had happened and what had been going on in this practice because I had just put this practice or this doctor on a pedestal and just knew that he was just an amazing person. Again, I'd known him for over 10 years personally. When I went to work there, I noticed after the first couple of days, oh my gosh, wow, I really need to get myself back in up to speed, on some of the areas of clinical dentistry that he was performing because did a lot of CAD CAM. I hadn't, God, hadn't done probably a CAD CAM restoration in maybe 15, 20 years. I have so much respect for assistants that do that. And I can tell you that it seemed like the first week he was already having me, scan, stain, or scan, design, stain, glaze, getting restorations ready and wanted me to be ready for that. Well, it was really hard for me because I did not want to just make restorations and seat them knowing I had full mouth reconstruction and know that anything that I am making, I want to make sure that I know exactly what I'm doing and that the color is there and that it looks beautiful and that I feel like what I'm designing is something that's worthy to be cemented. After about 2.5 weeks, I noticed he started getting frustrated with me. There were also some other procedures that I, just knowing what I know wasn't it was very hard. Some of the infection control protocols were not there. A lot of things put me in a situation that I really and truly would come home some days crying because I just wasn't sure. But putting those things aside, I really and truly hated the way that he was treating his team. And most importantly, I hated the way he was treating the assistants. I hated the way he was treating me. I would come home 2 times a week crying, sometimes more than that. Not crying for myself, but crying for the way that he would treat me, but most importantly, taking out his aggression when patients wouldn't get numb on patients, throwing things, shoving things in team members' faces. It was a hard thing to take in. But what was worse was talking to other dental assistants in our chat room and realizing how many other dental assistants were going through the same thing. And it was so hard for me to talk about it because I have been teaching dental assistants for a very, very long time. For myself, I wouldn't cry while I was telling this tonight. Um, but just being to make feel like you are such a horrible assistant. And it was amazing to me when I would talk about this in the chat room, how many dental assistants were feeling the same way and being made to feel the same way. you know, telling me about doctors throwing things, across the room, throwing instruments, shoving them, pushing them, doing these things. And I'm like, oh my God, this is so abusive. I heard this from other practices, but I never thought that it would be me. The dentists that I work for, they're probably watching this. Thank you so much for treating me so well and treating our team so well. It was so hard. I would come home and I'd look at these things on my wall and wonder, "Oh my god, how did I get there? How did I get this?" Because I am so dumb. I would come home and I would watch videos and I had my own platform for education. I felt so sorry for patients. Felt so sorry for this team. Felt so sorry for myself. Over the last couple of weeks, it's been very hard because it's the only practice in my life that I've ever walked out on. But when I left, I drove around for an hour crying. Not crying for me, because I'm a big girl. I mean, got 6 kids, hell, I can do just about anything. I'm crying for all the dental team members, all the dental assistants who are being treated the way that I was treated. Crying for all the patients that I know in my heart that I put this person on a pedestal knowing that he takes care of kids, special needs kids, and wondering, had he done them the way that he did me? That's when you have to ask yourself, is dentistry really where you want to be anymore? And that is a hard pill to swallow. So for the last couple of weeks, I had to walk away from it. I opened a dental assistant store and started making t-shirts and foam pops and things that could take me away from what I loved so much. And maybe you think, maybe this is it. I don't know if dentistry is all it is cut out to be. It's not what I thought it was. I was making $15 an hour. $15 an hour in this practice. It wasn't about the money. Shoot, that is not why I went. I went because I love people. I went to make a difference. I went to be fed, not fed to feed my family. I went to be fed my soul. You see, I'm doing this because I want those assistants who feel insignificant. I want those assistants who are 50, 60 to feel that you are loved and you are cared for and you are strong and you are amazing. And nobody should ever make you feel any different. We might be a little bit slow. We may not be able to keep up with the 18 and 20-year-olds, but let me tell you something. I can run circles around in my mind knowing exactly what I need to do to help you take care of that patient at the chair. So let me tell you, for you doctors tonight who have a good assistant who takes care of you and is the best reflection of your practice, you better go in on Monday and tell them thank you. You better find a way to give them a raise and take care of them, because I'm here to tell you right now, here in Virginia Beach, there are 38 openings for dental assistants right now. 38. I had 2 doctors call me yesterday looking for dental assistants. 2. Every week, I am getting at least 2 to 3 people calling me, asking me if I can help them find a dental assistant. Makes me question, why do you not have a dental assistant? Why do you not have a dental assistant? Where did they go? What was the reason they left? Because let me tell you, that wasn't what I was told. I was told that they moved. The one before that, decided they didn't want to be in dentistry anymore and she was going to go back to be an accountant. There is something wrong with that picture. I found out 7 assistants, gone through 7 assistants. When I walked in the door and no one even said good morning, I should have known right there something went right. And if this is you, you don't need to hire a consultant for me to tell you, you better get it together, because this is a small world. And these team members that are working for you for a reason. They're not working for you because of what you pay them. They're working for you because they care about people. We're not in dentistry to make millions. A dental assistant will never make millions. We'll never make millions. We won't even make 100,000. None of us make that kind of money. We make half of what everybody else in the practice makes. Do not treat your dental assistant like they are nothing. We deserve respect just like anybody else. Love your assistant. Take care of them. And I don't care if they're 50 years old. I don't care if they're 60 years old. I don't care if they move a little slow. I don't care if their back hurts and you feel like, oh my gosh, they're complaining about their back or they have to take a break because they're tired. You let them take their break. Because let me tell you something. I might not be fast. I might not know every single procedure. I may forget a step or two, but let me tell you something. I got all heart, and that's all you need for us to bring patients into that door. And if you don't know that, it is never about money. Never about money. And let me tell you, if you have an assistant that you feel is falling short in a certain procedure and they need help, then get them to help. The hardest thing to do in life is find somebody that really does care about people. Dentistry can be trained. And you better take a long look in the mirror for those doctors out there that are not treating your team members right. Because let me tell you something, that had nothing to do with me. The way that he was treating me and the way he was treating his team and our team at the time, it's ironic how I'm still very good friends with those people today. Two of them became two of my very best friends. So that was the best thing that I got out of that practice. Let me tell you something. Whatever's going on at home, don't take it out on your team. Find a way to get some help. Because let me tell you something. That's what I felt I needed over the last couple of weeks because I wasn't sure this is what I want to do anymore. And I can't let that one person keep me from helping and saving another dental assistant to get in the right practice that they deserve and to get the right education that they deserve to feel worthy, to feel like they are in the right place. So please don't do this to your team. Don't make them feel like they are nothing. Don't treat them like dirt. And most importantly, don't treat your assistants like a janitor. Treat them as an equal. Because I'm going to tell you, I'm so grateful for the dentist that I've worked for. I never knew how bad the other life lives until this. Do I forgive this doctor who's probably going to be watching this tonight? Yes, I already forgave you. I forgave you a long time ago. But I would tell you, I won't forgive you if you continue to treat your team the way that you treated me, because that's not right. And I would tell you that for any dental assistant that needs somebody to talk to who's going through what I went through, please call me. I want to be here for you and I want to help you through it. And I don't want you to get out of dentistry because of one bad thing that's happened to you, because there's a lot of great dentists out there who love and appreciate their assistants. And I want to help you find it because if you're not in the right place, you deserve better. And if you need me for anything, I want to be here for you too. So I appreciate you watching this tonight. Appreciate you letting me cry to you. It's been a hard pill to swallow. But I can tell you that last Friday I gave a lecture to 200 dentists for the ADA in Australia. And I want to thank UltraDent for giving me the platform to do that. That gave me so much strength to be able to do this tonight because I don't think I would have been able to. And I'm not even a dentist. I don't place direct composite. But I was teaching a course, repair, not replace, to 200 dentists live on a visualizer on a model. It's kind of ironic and funny. Don't think that we don't have the hands and the mindset to be right there with you. We just, again, might be a little slow, but we'll get there. But don't just kick us to the curb because of our age. You keep us because patients are going to be coming to that practice asking for us. And that's the most important thing you need to remember as a doctor. It's not always about how fast we are and how quick we are to pass these instruments. It's about what is in here that's going to keep you amazing too. Thank you so much for your time tonight.